Assalamualaikum warahmatullahi wabarakatuh. So for our first assignment in this semester, we will be talking about the application of polymer in rhinoplasty, or basically a nose job. Before we proceed with our discussion today, I would like to introduce our group members, starting with me, Amira Fakiha, Nur Hazrini, followed by Nur Aina Najiha, Nur Zulaika, and also Azwalina Najwa. So based on our topics of discussion, we could see that we're going to talk about the introduction, the applications, followed by the advantages, issues, and how to overcome it. In recent years, cosmetic surgery has witnessed a surge in popularity, driven by societal norms and an increasing desire for physical enhancement. Based on a Real Self Culture report regarding on the plastic surgeries in the USA, nearly 1 in 4 people, which makes up to 24% of them, have had at least one cosmetic procedure, and 12% of them have had 2 or more. Among the countless of available procedures, rhinoplasty, usually referred to as a nose job, has emerged as a prominent option for individuals seeking to refine their facial aesthetics. Various cosmetic health-related articles had published the increase in the percentage of surgical procedures from year to year for the face, which they can conclude that an average of 18% during the pandemic, totaling 346,384 people, and this includes procedures such as eyelid surgery, facelift, and also nose reshaping. In rhinoplasty, advancement in surgical materials and techniques have expanded the scope of possibilities, with Gore-Tex emerging as a notable option for nasal augmentation and refinement. Gore-Tex, a synthetic material originally developed for medical applications, has garnered attention within the field of rhinoplasty for its versatility and biocompatibility. As a porous material, Gore-Tex allows for tissue ingrowth, facilitating integration with surrounding nasal structures and promoting long-term stability. This unique property makes it an appealing choice for nasal augmentation procedures, where durable and natural-looking results are desired. So back to basic, Gore-Tex, or expanded polyfluoroethylene, is a polymer that is formed through addition polymerization by adding monomers, which is fluoroethylene, under high pressure and in the presence of free radical initiators.
Application of Gore-Tex in rhinoplasty. Gore-Tex is one of the polymer that is used in rhinoplasty surgery or nose job as one of the substitute for our natural cartilage that is best used in the nose augmentation. This nose surgery is to alter the structure of nose for aesthetic purpose, to increase self-esteem, and also for treating chronic sinus issues. In terms of nose surgery for aesthetic purpose, the 3D Gore-Tex implants is used to augment or build up areas of the nose that are deficient in volume or projection. For example, they can be used to increase the height of the nasal bridge or add volume to the nasal tip. It is a softer implant than silicone, thus replicating the natural nasal cartilage. Gore-Tex has microscopic holes, which act as pores, enabling the soft nasal tissue surrounding the implants to infiltrate the implant and fixate in place. Next, frontal sinus obliteration is a surgical procedure used to treat chronic frontal sinusitis or frontal sinus mucosal. In this procedure, the surgeon removes the diseased tissue from the frontal sinus and fills the space with a synthetic material like Gore-Tex to prevent recurrence of the condition. Gore-Tex implants can be shaped to fit the contours of the frontal sinus and provide a barrier to prevent the regrowth of tissue within the sinus cavity.
Next, moving on to advantages of rhinoplasty surgery. First, it improves our sleep quality. This is because snoring that happens because it is unable to pass enough air through nose while sleeping will be reduced, because rhinoplasty surgery helps to open up the airways and allows for easier breathing during sleep. Next, it helps to reduce sinus pressure. Sinus happens because of the dilated septum that causes the nasal cavity to be blocked. But when we use this surgery, the nasal septum will be corrected. The sinus will be emptied quickly. Next, rhinoplasty surgery also helps to improve breathing. It helps to correct dilated septum that is caused by birth defect. The nasal passage will be strengthened and the airflow will be improved. Next, The rhinoplasty surgery also helps to improve confidence in ourselves. This is because we will have a feeling of boosted self-confidence if our nose is pretty. Next, moving on to advantages of rhinoplasty surgery using Gore-Tex. First, it fortifies the placements in the nose. This is because Gore-Tex has good stability. It means that the implants has tiny holes in it that help tissue grows into it, making Gore-Tex will stay in place better. It will stick firmly to the nearby tissue and doesn't move around. Next, Gore-Tex looks very natural on the nose. It will not make our nose look like artificially lifted bridge because it integrates very well with our nose tissue. Next, surgery takes shorter time because it is easier to shape than other product. Lastly, it can withstand higher temperature. This is suitable for hotter countries like Malaysia, Indonesia, and Singapore.
Moving on to the next part, which is issues and limitation of Gore-Tex. So Gore-Tex is used for soft tissue augmentation in the nose, and it's not recommended as a structural graft. It has an overall complication rate of 3.2%, and it has sufficient ingrowth to stabilize the implant, but it lowers the graft removal if it has encountered complications. Gore-Tex is used in general and vascular surgery. It has low tissue reactivity, excellent biocompatibility, and reasonable cost. Its microporous composition encourages tissue ingrowth, which confers stability to the implants. So, due to these characteristics, the implant firmly adheres to the surrounding tissues and prevents migration. It can fill or contour a defect, but it provides little structure at the implant site. In a multi-center, retrospective study on 309 patients who underwent dorsal nasal augmentation with Gore-Tex implants, and 3.2% of the implants were infected in the patients with nasal septal perforation. So, about nasal septal perforation, as we all know, the nose has two cavities, which is nostrils, which are separated by a septum. This is made from both bone and cartilage and is responsible for separating the nasal cavities and channeling airflow into the nose. A perforated septum describes when a hole develops in the septum, which, depending on the size of the hole, which can cause mild to extreme symptoms. Septal perforation occurs most commonly along the anterior cartilaginous septum. The main feature of a perforated nasal septum is a hole in the septum, which can vary in size, which is less than 1 centimeter to more than 2 centimeter. Sometimes, you might not be aware of a perforated nasal septum, especially if you haven't experienced any symptoms. So here are some of the symptoms that we can identify. The first one is nose pain, headache, nosebleeds, wheezing when breathing through the nose, feeling like the nose is blocked or obstructed, and the last one is gagging in the nose.
Next, let's have a look at how we can overcome the issues that have been mentioned just now. First of all, there are non-surgical measure and surgical measure to fix nasal septal perforation. Surgery usually is not the first step in treatment. The doctor may suggest an ointment or regular saline rinse. The holes in the septum can increase dryness and may lead to nosebleeds. This is because it's common for the edges of the hole to form a crust and bleed. Therefore, saline nasal spray can help by keeping the inside of your nose moist. Your doctor also may recommend prosthesis to block the hole in the septum. Prostheses can eliminate nose bleeding, whistling, and reduce nasal awareness. Obturators for prostheses are available in a variety of materials including celestic, silicone, and acrylic, and can be custom-made using information from 3D CT imaging. However, only 50% of patients with nasal obturation report long-term compliance and satisfaction. Next is surgical measure to fix nasal septal perforation. The surgery usually takes 1 to 3 hours and patients typically can go home the same day. Some doctors use closed surgery where they go in through the opening in your nostrils, while others may open up your nose for better access. This is all depending on where the hole is and how big it is, as well as their skills and experiences. Typically, they will take tissues from your nose or even your mouth to cover the hole. However, the effectiveness of this procedure depends on the size and location of the perforation. If the perforation is small and located in a less critical area, it may be possible to repair it using conservative measures such as topical medication or steroid injections. To protect your nose as it heals after the surgery, it's best to not pick your nose or blow it too hard. Sneeze with your mouth open and rinse with saline as often as the doctor tells you to. Most of the time, you will feel back to normal within a few weeks.
That's all from us, and thank you for listening.